So this patient's coming in for a rapid developing growth on his right forearm. This is suspicious for a squamous cell cancer. Could be a keratoacanthoma. If you pan down this way, you can see how mottled this patient is. This is not just the fact that this patient's a little bit older. This patient's had a transplant, and the anti-rejection medications that you take oftentimes will have this occur, and you're quite mottled. And that's the other concern we have with this. Regrettably, we're affecting his immune system, and these can develop very, very quickly. I've had patients that this gets out of control fairly quickly, so you want to make sure we get on top of this. And this is why, as opposed to like doing a shave biopsy or sending it off, we want to just take this tissue out, because I've seen these progress so quickly in patients of this type. So we've added freezing around through here. Does that hurt at all when I do that?
No.
No pain there at all. So again, I'd expect this to be fairly vascular. So this is our number 15 blade here. So I do want to make sure that I'm on the outside. No pain there at all?
No,
Just
a
pressure.
little pick.
Is it more like, is that on a scale of 1 to 10? Is that a...
Oh no, it's gone now. I
Okay,
just
okay.
did a little bit at the beginning.
Okay. If you feel anything more than that, let me know, because you really shouldn't feel anything. That's not hurting?
No.
Okay. So again, this field isn't infected, so we should have very good anesthesia.
Oh, sorry.
That's okay. So again, his skin's going to be very friable. And that's again because of the condition of what's going on. So I want to be behind this, just make sure there's no, there almost never is like deep penetrating growth that's really far gone. The speed with which this developed would make that less likely. There you go. Oh,
Okay.
Can you grab the bifurcator? So this is one, I'll just try to bifurcate a couple spots that are bleeding, but I'm not too worried about this. So if they don't tamponade, or cauterize, I should say, I'm going to tamponade them with the actual sutures. I'm just turning the gain up on this. So this one I'm just going to get with the stitches. So here again, because again the tissues are so redundant, that comes together so nicely. I won't even use dermal stitches with this. I'm just going to put regular stitches in. Just put pressure there for me, please.
Sure.
Skin's so elastic that where I punctured it, punch back out. Just have it for me. You're okay? You're comfortable?
Mm-hmm.
So we're certainly going to send this off for pathology, and then as long as we have margins that are completely clear, then regardless of whether this was even, squamous cell cancer, basal cell cancer, even melanoma, then we'll be done with at least this portion. Now, the more aggressive ones, we'd have to do some additional testing, but I don't think that's going to be relevant here. Right. So you can see what I mean. So it's not backfilling. So that area that was sort of bleeding a bit briskly through here, that's been cut off by the actual stitches. And so while you wouldn't be faulted by, tying something off or doing more detailed cautery, I just don't find it's necessary for areas like this that are accessible and you can get them with your stitches. So the areas where we really worry about that is when there's not going to be pressure exerted either from a bone in the area that's putting back pressure on them, so like this, or you can put a nice tight stitch or a nice tight bandage on it. So here, the scalp, those type of areas are fine. It's always when you're dealing with the core aspects, so the chest, the abdomen, where you have to really worry about making sure that you cauterize off any type of active bleeding, because those ones won't tamponade well at all. You're still comfortable?
Mhm. I'm worried about the Band-Aid when I take it off.
We won't put a Band-Aid on you. So,
Oh,
and again, because his skin is so thin, probably any adhesives would tear the skin. So in these cases, we're going to put like a wrap around his arm and tape to the wrap so that we don't tape on his skin. Yeah, your skin tears a lot with bandages? Do you find?
pardon?
Do you find your skin tears a lot with bandages?
Oh, jeez, yeah.
Yeah.
When I take a Band-Aid off, the skin comes with it.
Yeah, unfortunately. And again, that's not his fault or the fact that he's a little bit older. That's because of the conditions he's had and the medications we put him on. So you can see here when the subcutaneous tissues bulge a bit, you'll see me do this before. As opposed to going right through, I'll go through and then I'll use the needle to push down the subcutaneous tissues, and then I'll go through again. So that way when I tie it, it stays down so the tissues don't poke through. That's something, if you do stitches, you'll understand what I mean. You just have to do that a little bit when it's got a lot of subcutaneous tissue that's there. Do you want to grab me another cartridge? I'm going to need to do one more.
Oh.
So this is healing up nicely, so I'm just going to add one more stitch in, and then we'll just have him back in about 10 days. You can